Richard Dawson is 72 years old, retired high school football coach from Tulsa, Oklahoma. He still walks 3 miles every morning. He eats well. He sleeps well. His wife says he has more energy than she does. Richard goes in for his annual physical, feeling great. His doctor looks at his chart, looks up and says, "You know what, Richard? Let's run a few extra tests this year, just to be safe." Richard doesn't question it. Why would he? His doctor has always had his best interest at heart. 8 weeks later, Richard is lying in a recovery room after a surgery he did not need, for a condition that would never have harmed him. And the life he was quietly enjoying has changed in a way no one in that room expected. What happened to Richard happens far more often than the medical system likes to admit. And what I'm about to share with you today deserves a very serious conversation. I'm Dr. Michael Carter, and this channel is dedicated to one thing: helping adults over 60 understand what the medical evidence actually says about their health, in plain language, without the jargon and without the fear. Let me be clear about something before we begin. I am not against medical testing. Testing saves lives. What I am against is medical testing that statistically does more damage than the disease it's looking for, especially after 65, when your body handles interventions very differently than it did at 50. And the uncomfortable truth is that several of the most common routine checkups seniors are told to keep getting are no longer supported by the very organizations that wrote the guidelines. Today, I'm walking you through 5 specific medical checkups that I would personally never get after 65, and I'll explain exactly why the evidence says the same. Stay with me through all 5 because number 3 creates false alarms in nearly 1 out of 3 older adults who take it. And number 5 is the one most people have never even questioned until it's too late. If you're over 60 and you get annual checkups, I need you to subscribe to this channel right now, because this might be the most important conversation you have before your next doctor's appointment. Before we get into the 5 checkups, I need to install one concept in your mind, because without it, nothing I'm about to say will fully make sense. I call it the screening paradox. Here's how it works. Pillar 1, the detection trap. Medical technology today is extraordinary. It can find abnormalities so small they would never cause a symptom, never grow, and never shorten your life by a single day. But the moment something appears on a scan or a lab result, medicine doesn't have an ignore button. It has a treatment button, and that button gets pressed whether the finding is dangerous or not. Pillar 2, the age equation. The same screening test that buys a 50-year-old 30 more years of healthy life can cost a 75-year-old their independence. Why? Because the risks of follow-up procedures, surgery, sedation, biopsies, hospital stays, rise sharply with age. But the screening schedule doesn't adjust. It stays the same as if your body were still 50. Pillar 3, the cascade chain. One unnecessary test finds a minor abnormality. That triggers a follow-up scan. The scan recommends a biopsy. The biopsy leads to a procedure. The procedure causes a complication. And suddenly, a person who walked into the clinic feeling perfectly healthy walks out a patient. All because of a test they didn't need. That's the screening paradox. More testing doesn't always mean more safety. Sometimes it means more harm dressed up as caution. Keep that in your mind as we go through each one. Checkup number 1, routine colonoscopy after 75. Let me tell you about Gloria Patterson. Gloria is 78 years old, retired postal worker from Memphis, Tennessee. She had 2 colonoscopies in her 50s and 60s, both completely clean, no polyps, no family history of colon cancer, no symptoms of any kind. But Gloria's new primary care doctor looked at her chart and told her she was overdue. Gloria had questions. She had heard things, but she didn't want to seem difficult. She didn't want to be one of those patients, so she went. The prep, the harsh liquid you have to drink the night before to completely clear your bowels, hit Gloria's kidneys hard. By 4 in the morning, she was confused, shaking, and barely able to stand. Her daughter found her on the bathroom floor and rushed her to the emergency room. Her electrolytes had crashed to dangerous levels. Her heart rhythm was at risk. Gloria spent 5 days in the hospital, hooked to an IV, surrounded by machines monitoring her vitals. She never even made it to the colonoscopy. And the most painful irony of all, She didn't need it. Here is what the evidence says. The United States Preventive Services Task Force, the same organization that sets screening guidelines for doctors across the country, recommends against routine colonoscopy screening for average-risk adults after age 75. After 85, they recommend against it entirely. Data published in the New England Journal of Medicine shows that complication rates from colonoscopy in adults over 75 are significantly elevated. Perforation risk goes up. Bleeding risk goes up. Sedation complications increase. Aspiration events increase. And the benefit window narrows dramatically because slow-growing colon cancers detected at 78 often will not become clinically significant within the patient's remaining life expectancy. You find something that will never hurt them, and the process of finding it nearly kills them. If you are over 75 with a history of clean colonoscopies and no symptoms, talk to your doctor about non-invasive alternatives. The FIT test, fecal immunochemical test, or Cologuard, a stool DNA test, can both be done at home with no prep, no sedation, and no risk. They are not perfect, but they are effective screening tools that don't put your body in danger. And if you do have symptoms, blood in your stool, unexplained changes in bowel habits, that changes the equation entirely. See your doctor. But routine screening in a healthy 78-year-old with a clean history is not evidence-based medicine. It is a checkbox on a chart. If you've ever been pressured into a medical test you weren't sure about, type "pressured" in the comments right now. I want to hear your story, because you are not alone. But the next one is where the overdiagnosis problem gets truly alarming, and it affects millions of men over 65 right now. Checkup number 2, routine PSA. Prostate screening after 70. Warren Mitchell is 73, retired carpenter from Dayton, Ohio. Annual physical. His doctor adds a PSA blood test as routine. Warren doesn't think twice about it. The results come back slightly elevated, not alarmingly high, just slightly above the normal range. His doctor recommends a biopsy. Warren agrees because he trusts his doctor. The biopsy finds low-grade prostate cancer, and the moment Warren hears that word, cancer, his world stops. He assumes the worst. He agrees to surgery because who wouldn't? Who hears cancer and says, let's wait and see? After surgery, Warren has permanent urinary incontinence. He wears pads every day. He has erectile dysfunction that medication cannot fix. His marriage suffers. His confidence collapses. He stops going to his woodworking club because he's embarrassed. And 6 months later, when he finally sees the full pathology report, his surgeon tells him something that takes the air out of the room. The cancer they removed was so slow growing, so biologically indolent, that it would never have caused a single symptom in his lifetime. Warren lost his quality of life treating a disease that was never going to hurt him. The United States Preventive Services Task Force recommends against routine PSA screening in men over 70. The American Urological Association agrees, and the data is staggering. Studies published in the New England Journal of Medicine estimate that for every single prostate cancer death prevented by PSA screening in elderly men, approximately 40 to 50 men are overdiagnosed and overtreated. That is not a typo. 40 to 50 men undergo surgery or radiation, with all the life-altering side effects that follow, for every one life saved. And up to half of prostate cancers detected by PSA in men over 70 are clinically insignificant. They are biologically asleep. They will never wake up. If you are a man over 70 with no symptoms and no family history of aggressive prostate cancer, have a genuine shared decision-making conversation with your doctor. Not a 15-second, we'll add a PSA to your blood work. A real conversation. Ask, if this test finds something, what is the realistic chance it would ever harm me in my remaining lifetime? And what are the side effects of treatment compared to active surveillance? Those two questions can save you from becoming another Warren. Now that one affects men, but the next checkup affects everyone, and it produces false alarms at a rate that should make every senior deeply uncomfortable. Checkup number 3. Annual EKG and cardiac stress testing for people with no symptoms. Evelyn Marchetti is 69 years old, retired school cafeteria manager from Providence, Rhode Island. No chest pain, no shortness of breath, no dizziness, no exercise intolerance, no cardiac symptoms of any kind. But at her annual checkup, her doctor says, "Let's get a stress test. You're at that age." Evelyn doesn't argue. She's at that age, whatever that means. The stress test comes back with what the report calls a borderline abnormality. Her doctor explains that it's probably nothing, but recommends she see a cardiologist just to be safe. The cardiologist recommends a cardiac catheterization, an invasive procedure where a thin tube is threaded through a blood vessel in your groin all the way up to your heart. Evelyn is nervous, but she trusts the process. The catheterization results come back completely clean. Her arteries are wide open. There is nothing wrong with her heart. But during the procedure, the insertion site in her groin bleeds more than expected. She develops a hematoma, 2 more nights in the hospital, a follow-up appointment, a bill she didn't expect, and an anxiety about her heart that she carries with her for months after, even though there was never anything wrong. Evelyn walked into her annual checkup a healthy woman. She walked out a cardiac patient. Except she was never a cardiac patient. The test made her one. Here is what the guidelines actually say. The American College of Cardiology and the American Heart Association explicitly recommend against routine EKG or stress testing in asymptomatic adults. The USPSTF says the evidence is insufficient to support cardiac screening in low-risk patients with no symptoms. And the false positive rate is what should stop every senior in their tracks. Published research shows that routine cardiac stress tests produce abnormal results in nearly 1 out of 3 older adults who have no actual heart disease. 1 in 3. That means for every 3 healthy seniors who take this test, 1 of them will be told something is wrong when nothing is. And that false alarm starts the cascade chain I described earlier. Cardiology referral, advanced imaging, possible catheterization, possible complication, possible hospitalization, all from a test that found a ghost. If you have no symptoms, no chest pain, no unusual shortness of breath, no exercise intolerance, a routine cardiac stress test is likely unnecessary. If your doctor recommends one, ask one simple question. What symptom are we investigating? If the answer is, just to be safe, or you're at that age, that is not a clinical indication. That is defensive medicine, and your body pays the price for it. Those first 3 affect obvious areas: gut, prostate, heart. But number 4 is one that millions of women are being screened for after 65, without ever being told they have every right to stop. Checkup number 4. Cervical cancer screening, the pap smear, after 65. I'm not going to use a patient story for this one, because the systemic data tells a story that matters more than any single experience. The United States Preventive Services Task Force gives cervical cancer screening in women over 65 a grade D recommendation. That is the strongest possible recommendation against a screening test. Not consider stopping, not weigh the risks. Grade D means the evidence shows the harms outweigh the benefits. The American Cancer Society agrees. If you are a woman over 65 who has had adequate prior screening with consistently normal results, meaning 3 consecutive normal pap smears or 2 normal HPV co-tests in the prior 10 years, the guidelines say you are done. You can stop. And yet, studies show that a significant percentage of women over 65 continue receiving annual pap smears they do not need. Why? Because the medical system operates on autopilot. Doctors included in annual well-woman exams without reevaluating each patient's screening history. Patients comply because no one ever told them there was a stopping point. And in a culture that equates more screening with better care, saying you can stop this test feels counterintuitive. It feels like giving up, but it is not giving up. It is following the evidence. Now, the pap smear itself carries minimal physical risk, but here is what does cause harm. As women age, cervical tissue changes naturally. These changes are not cancerous, but they can trigger abnormal pap results that have nothing to do with cancer. And each abnormal result triggers the cascade. colposcopy, biopsy, anxiety, sometimes unnecessary procedures. The emotional toll of being told something abnormal was found, even when it turns out to be nothing, is real, measurable, and completely avoidable for women who have already been adequately screened. So here is what to do. At your next gynecology appointment, ask this question. Based on my screening history, am I eligible to stop pap smears? If you've had 3 consecutive normal results and you're over 65, the evidence says yes. This isn't skipping care. This is care that's guided by science instead of habit. If you're a woman over 65 and you had no idea you could stop getting pap smears, type "no idea" in the comments. I think the number is going to surprise all of us. And now, the final one. Number 5. This is the screening test that sounds responsible, feels harmless, and has the most dangerous cascade of all 5. Most people have never questioned it. After today, you will. Checkup number 5. Carotid artery ultrasound screening in people with no symptoms. Eugene Holloway is 76 years old, retired school bus driver from Fort Wayne, Indiana. One Saturday morning, Eugene sees a sign at a local health fair. Free carotid artery screening. Know your stroke risk. Eugene thinks, why not? It's free. It's non-invasive. It takes 10 minutes. He sits down. A technician runs an ultrasound wand along both sides of his neck. 15 minutes later, someone hands him a printout that says he has 40% blockage in his right carotid artery and recommends he follow up with his doctor immediately. Eugene is scared. He calls his doctor Monday morning. His doctor refers him to a vascular surgeon. The surgeon reviews the ultrasound and recommends a carotid endarterectomy, a surgical procedure to open the artery and remove the plaque. Eugene doesn't know what questions to ask. He just knows there's a blockage and a surgeon is telling him to fix it. He agrees. During the surgery, Eugene suffers a stroke on the operating table. The surgery that was supposed to prevent a stroke caused one. Eugene loses partial mobility on his left side. His speech is affected for months. He can no longer drive. The independence that defined his retirement, gone. A free screening at a health fair on a Saturday morning changed the trajectory of Eugene Holloway's entire life. Here is what the evidence says. The United States Preventive Services Task Force recommends against screening for asymptomatic carotid artery stenosis in the general adult population. This is a grade D recommendation, meaning the harms of screening outweigh the benefits. Data published in The Lancet shows that carotid endarterectomy carries a surgical stroke and death rate of 2 to 3%, even in the best surgical centers in the world. For patients with moderate asymptomatic blockage, like Eugene's 40%, the risk of the surgery itself can equal or exceed the risk of the blockage ever causing a stroke on its own. The free test was the most expensive thing that ever happened to him. Let me walk you through this cascade one more time, because I need you to feel the full weight of it. A free screening finds a blockage that is causing no symptoms. The patient is referred to a surgeon. The surgeon recommends surgery. Because surgeons operate, that is what they are trained to do. The surgery carries a real risk of the very thing it's trying to prevent. The patient suffers a complication, and the outcome is worse, measurably, objectively worse, than if the screening had never happened. Unless you have specific symptoms, transient vision loss in one eye, sudden weakness on one side of your body, difficulty speaking, carotid artery screening for asymptomatic adults is not recommended by any major guideline organization, not one. If a health fair, a mobile screening van, or a wellness event offers you a free carotid ultrasound, the evidence says this clearly. Politely decline. The safest screening is sometimes the one you don't take. That brings us to the tool I want you to take away from this video. I call it the screening safety check. 5 questions you should ask before agreeing to any medical test after 65. Question 1. What specifically are you looking for with this test, and what is my actual risk for that condition? You deserve to know the specific concern, not a vague, just to be safe. Question 2. If this test finds something, what are the treatment options for someone my age? because a finding that's treatable in a 50-year-old might not be safely treatable in a 78-year-old. That changes whether the test is worth doing in the first place. Question 3. What is the complication rate of the procedure that would follow an abnormal result? This is the question almost no one thinks to ask. Every follow-up procedure carries risk. You deserve to know that risk up front, before the test even happens. Question 4. What happens if we monitor this instead of treating it right now? For many conditions found in older adults, watchful waiting with regular monitoring is a legitimate and often superior medical strategy. Not every finding needs intervention. Some need observation. Question 5. What is the most effective non-invasive alternative? Because very often, as with colon screening, heart health, and stroke prevention, lifestyle changes, medication, and non-invasive monitoring outperform procedural intervention with far less risk to you. Any good physician will welcome these questions. They will respect you more for asking them. And if your doctor dismisses you, rushes past you, or makes you feel difficult for raising these concerns, that is important information about whether that doctor is the right fit for your health. Let me come back to Richard Dawson, the man from our opening who walked into his annual physical feeling better than most people half his age. Richard's just to be safe tests found a small abnormality that turned into a referral, that turned into a surgery that took 4 months of his independence. His wife became his caretaker. His morning walks stopped. He told his daughter one evening, sitting in a chair he used to never sit in, "I was fine before that appointment. I just wish someone had told me I had a choice." You do have a choice. And I want you to hear this clearly. There is a difference between medicine that finds things and medicine that helps you live well. After 65, the goal of your healthcare should not be to generate findings. It should be to protect your quality of life, your independence, your energy, and your ability to do the things that give your life meaning. Doing less sometimes takes more wisdom than doing more. And the bravest thing you can say in a doctor's office is simply this: do I actually need this? If this video changed the way you think about your next checkup, subscribe to this channel. I make videos like this every week, evidence-based, honest, and built to help you take real control of your health in the years that matter most. Tell me in the comments, have you ever had a routine test that led somewhere you didn't expect? Your story might be exactly what someone else watching right now needs to hear before their next appointment. Take care of yourselves. I'm Dr. Michael Carter, and I'll see you in the next one.